Allora, buon pomeriggio.
Good afternoon. I suggest that we begin our scientific session now, the purpose of which is to give us an overall view, an overall picture of the clinical aspects of PCDH and the neuropsychological function and alteration. It is very important for the scientific aspect to be presented appropriately to the families and parents of patients, because this strengthens the awareness as to the priorities that might vary from one family to the next according to the main problems that the different patients present. Indeed, as you well know, there's a great variability here. Now, in order to foster discussion, I prepared an individual slide which seeks to summarize the history of how we've been able to define the syndrome, the mutation of the Prof.Guerrini. It's rather difficult to give a name to this syndromic picture or syndrome because of the great scientific variability. But if we look at history, I think this will help you understand some terms that you will hear about later, and you will better understand how to locate the information that you will receive. There's no pointer here, and the interpreters cannot see the slide, so I'm sorry, but the interpreters cannot hear the speaker. He needs to speak into a microphone, please.
Vabbè, ho capito. Va bene così? Is it right now? Are you...
Thank you for doing that. Now we can finally hear. Thank you very much. Now, I was saying a syndrome which had been defined according to fibrils and crises. In other words, subjects who had fever and who had crises generalized, often in family, and that went beyond the typical age, which is about 5 years. And some went on to develop generalized epilepsy. Some of these had a more severe picture and a clinical picture, which then sometimes was borderline with the Dravet syndrome. The Dravet syndrome is a very severe epileptic syndrome which begins at age 1 year. The crises are prolonged. They occur during fever. Repeated hospitalizations are necessary, even in intensive care. And then there is the decline of cognitive function, which becomes apparent as of year 2 of life. And then other types of crises later on. Now, the common gene for the two syndromes was identified as the SCN1A, the sodium channel, but it was seen that not all patients had this kind of mutation, not all of them with the Dravet syndrome. Some of them did not have this type of mutation, so here we have a question mark. Now, based on studies done on patients without seizures, a group in France identified a group that had a strange chromosome combination, 2 X chromosomes, of which one was interrupted because of derangement in an area that involved the Prof.Guerrini gene. So that group had a biological indicator. There was research done on other patients that had been referred to that laboratory with the Dravet syndrome. There was a molecular analysis in which SCN1A was negative. Therefore, their initial work told them that they had found the second gene responsible for the Dravet syndrome. But you see the red dot here, because only a very negligible number of patients with a picture similar to the DS have mutations of this type. In parallel, on the other side, I'm colorblind, so I can't tell you what color that is, I'm afraid. But anyway, the last color right there says epilepsy mental retardation limited to females. In Australia, there were groups of patients with girls affected by EFMR, and those who transmitted the disorder could have been the mother or the father, but the father was always healthy, and so these colleagues identified a syndrome, but they didn't quite characterize the epileptic manifestations. Then the epilepsy girls, this was work done by our group with Specchio and Dr. Guerrini. In more extensive studies with girls affected by epilepsy, whose origin was not quite understood, we realized that about 13 or 12% of them had mutations of Prof.Guerrini, and that only some of them had a picture similar to that of the Dravet syndrome that had been described previously. But almost all of these girls had these seizures with fever repeated in clusters, even with free intervals, but with variable cognitive impairment, some of them even autistic. Then we got together and we formed an Italian group, and we studied the critical manifestations of 35 girls, and Dr. Guerrini will talk about that, and whose seizures had been recorded. So we put together all the data that had been gathered, and what emerged is what you see here. In other words, many subjects had a picture that's quite different from that of the Dravet syndrome, because they do have seizures, and they do have them in clusters. They do concentrate in the time when they're affected by fever, but often they have partial seizures involving the limbal system, which is a part of the brain that's rather archaic, which concerns some behavioral aspects related to emotions and fear. Now, this over time will lead us to reassess and revisit these aspects in patients where we didn't think the Prof.Guerrini gene was involved. And I think we will have to link up with basic research that studies the expression of genes that regulate brain development. We already know that the development of the amygdala, which is a very important component of the limbal system, is highly conditioned by the expression of the PCDH19 gene. All this to say is that what seems to be emerging right now is this bell-shaped type of trend. There's a syndrome, and most patients have a phenotype that's characterized by certain clinical manifestations that occur most frequently. But then there are some that are affected more slightly, a minority, I would say, and others yet who are affected much more seriously. So we do not yet understand completely what the trend of this bell is. I think we will only be able to understand that fully in a few years' time when we use the clinical aspects that are distributed, and when we look at more patients based on the mutation studies. But this work is of paramount importance to define this part. Otherwise, it's going to be difficult to form a group. The only common aspect of which is gene mutation. It's much more important to try to understand what the core syndrome is. This being said, I'd like to give the floor